Over to you.
Thanks, Monique. Thank you all for being here and spending an hour of your Tuesday to be here with me. This is an exciting presentation for me because it gives me a chance to share the first of my postdoctoral studies, so hopefully one of many. So before I get into the nitty-gritty, I'd like to thank a few people. So thank the Institute for supporting my work and supporting work that I think is valuable to workers and workplaces. I also want to thank my co-authors, Monique Gignac and Peter Smith, who have been instrumental in all the different aspects of this project, sharing their expertise. And now we're at a point where we've submitted this for peer review publication. So hopefully you'll have something to read, and you can also email me more questions that you might have. And also, I'd like to thank Statistics Canada, which compiles the surveys. One of the surveys I'll be explaining and describing today. And all the staff that collect this information, that go into these surveys, collect the information, as well as all the volunteers that spend their time providing information that is so useful to research like this. So, health promotion. And I'm sure all of you have your ideas about health promotion. And the idea of health promotion is that we're really promoting healthy lifestyles, healthy behaviors that get people to reduce their stress, be more active, sleep better, drink less, reduce smoking. And all these ideas are around this concept that if we lead a healthy lifestyle, we can reduce our risk for a whole host of chronic conditions, improve our quality of life, and live longer, right? So ideal things we all want to do. And the workplace has really taken up on this, and it's often been considered an add-on. We are inundated with different types of promotion programs at work. They can come in the form of flyers, leaflets, educational assistance programs, Pilates classes, yoga classes, standing desks, and all these are there. You know, oftentimes they're thought of, but sometimes they're not. They're kind of just a slight consideration in getting people to address their lifestyles. So the benefits seem to be many, and the evidence suggests that if you incorporate health promotion in your workplace and people actually follow them, then there's a whole host of positive benefits. If you get people to follow these, then they can potentially reduce their risk for chronic conditions and health, and improve their health. And if they're healthier, they are less likely to be absent from work. Then if they feel healthy at work, they will improve presenteeism as well. And with that, there are also organizational benefits. People like to work for organizations that they feel care about them and care about their health. There's reductions in healthcare costs, reductions in disability claims, and generally this is just awesome. That's what you think. So more and more organizations are in line now and drinking the Kool-Aid. And and we've always been thinking that it's important to protect workers on the job and keeping them safe while they're doing their job. But more and more organizations, such as the World Health Organization and National Institute for Occupational Safety and Health and their Total Worker Health Program, are pushing this concept that health, worker health, and health in the workplace is a social determinant of overall health. So the experiences of people while they're at work can shape their overall health because we spend so much of our day at work. And we're thinking of now combining that. Not only do we need to be thinking about occupational health and safety and protecting workers, but also promoting health so that we look at an overall, the overall health of workers at work and beyond as well. So, physical activity-based health promotion. So that's one form of health promotion, but often the most promoted. It's most promoted because it's often the most in vogue in many ways. You're not really going to be creating a lot of controversy if you're providing a program to get people to exercise as opposed to maybe getting rid of fast food items in the cafeteria, right? So in that way it's great, but maybe another reason is that exercise and physical activity is a really multifaceted intervention in that exercise, physical activity is a very important medicine, and if you follow those physical activity guidelines of meeting 150 minutes of moderate intensity physical activity in a week, you get a whole host of health benefits. There's mental health benefits. You feel better. You reduce your stress. There's mobility benefits. It reduces your risk for musculoskeletal disorders. So with that, it's very commonly promoted as a health promotion program. But that being said, it isn't easy. And we know that because, well, it turns out that most Canadians aren't meeting physical activity guidelines. I think the most recent statistic is that 15 to 30% of all Canadians are physically active, so they're not getting those benefits of exercise for health. So that's all fine and dandy, but maybe it's the case that workplaces can play an important role in getting people to be physically active. So workplaces are where we spend most of our day, a third of our day is at work, and there seems to be evidence that our resources around us, our environment, can play an important role in making it easier or hard for us to exercise. So if we can hypothetically think of the workplace as being one of those environments that we come across, then maybe the workplace can play a critical role in getting people to meet those physical activity guidelines and overall being more healthy. Okay, so if I was to explain that a little further, I like to think of this as a cross-section of an onion. So at the core of the onion is ourselves, it's our health, and health can affect whether we feel comfortable doing certain activities, or it can even be a motivation boost. If we associate physical activity with something that makes us feel healthier, we're more likely to do it. It's also related to the next level, which is our relationships with people. Some of us like to go jogging if we have a buddy to go jogging with. And also if we're if we're shamed by our peers, then we might be more likely to take part in a health promotion program at work. And then the next level is our environmental factors, and that's really where I think the workplace falls into. And that we look at the resources around us and also the built environment. So the built environment can be the neighborhoods we live in or our workplace, and those can facilitate the resources we have available to us. It can also be that if we live in a neighborhood where we don't feel safe going for a walk, going for a jog, we might be less likely to do so. So the workplace falls into that because, well, if we think about the resources we provide at work, some of that, if we provide more and more resources, it seems to make sense that then we might be more likely to then say that this is worth our time, that we can fit it into our day and be physically active and then go back to work. So that's just where our mind was at when we came up with this project. So physical activity promoting facilities at or near work can be directly provided by the workplace. So these can be facilities such as a recreational space. It can be gyms or fitness facilities. It can be the provision of health programs like Pilates or yoga to employees. It can also be indirectly provided. It's not necessarily provided by the workplace, but as a result of the environment of the workplace. So a built environment. So having a nice and pleasant place to walk, go for a jog, or having a playing field nearby. So those are all positive things that we think will get people to potentially increase their physical activity. So that leads us to our research questions. We were interested to know, do these workplace physical activity promoting facilities at or near work, is there any association between these facilities and increased leisure time physical activity? So by leisure time physical activity, I mean recreational physical activity, not associated with the requirements of work and not associated with transport. So I'll be calling physical activity promoting physical activity facilities at or near work, workplace facilities from now on, because that's very wordy. So we worked with the 2007 and 2008 Canadian Community Health Survey, and that was 10 years ago, so you'll be asking me, this is out-of-date information. But we don't think a lot of this information is out of date if you think that practices don't often change too much over the years. But what was unique about this particular survey is that they asked Canadians across Canada one question that was unique. So it was, at or near your place of work, do you have access to a pleasant place to walk, jog, bicycle, or rollerblade, playing fields or open spaces for ball games or other sports, a gym or physical fitness facilities, organized fitness classes, organizational, recreational sports teams, showers and or changing rooms, programs to improve health, physical fitness, or nutrition? So these are the questions that people responded. And we wanted to get a sense then, so these are all the facilities that people reported having access to them. And we wanted to see what is available to Canadians. So we started off with 132,000 respondents to this survey at the time. And then we looked at people who were of employable age, so between 18 to 75, who were employed or self-employed or working at home, and who had no limitation that affected their physical activity at home or at work. Then we filtered that down to about 68,000 people, and then we wanted to make sure that we had responses in that survey that we could use in our analysis. So anyone who didn't respond to any of the particular variables that we looked at were removed, so we ended up with about 61,000 people that we analyzed. So when I said I wanted to see, well, we wanted to see what people were doing, we had a nifty statistical technique, which we call latent class analysis, where we could see what are the types of people, what types of facilities are people reporting as being available to them at work that promote exercise. So we put it in this little funnel, and we came up with different naturally occurring combinations in that population. So different combinations, not looking at them as standalone health promoting interventions, but what are the different types of facilities available to people? And then we looked at the different types of people that report these facilities. So what this graph shows is essentially that there's a lot of variation, and we identified 5 different combinations. You get people who kind of reported having a bit of everything, so a high probability of reporting a bit of everything. So on the x-axis is just each facility, and the green is being people reported a bit of everything. And the bottom is people who kind of reported not really much of anything being available to them. And then some people had a bit of something and not very much of something else. So if you were to quantify that, these are probabilities, and we had 5 different groups. So the first group being our all group, and these are people who said they had a high probability of, they had a high probability of reporting all the questions on that survey. So having a pleasant place to walk, playing fields, gym, fitness classes, organized sports teams, showers, changing rooms, programs to improve health. And that was 24% of our sample. Our second group had a high probability of reporting having a pleasant place to walk and playing fields. So that was about 15% of the sample. And the next group had a pleasant place to walk, a medium to high rate of that, probability of that, a gym, fitness classes, showers and changing rooms, and health programs. And then the fourth group had a medium to high probability of pleasant place to walk, showers, and health programs. And that was the lowest group in the survey of about 5%. And then a relatively low probability of having a pleasant place to walk and showers and changing rooms were in group 5. And that was about 18%. So we consider them to be almost equivalent to those having nothing at all. So these were the people with the lowest access to physical activity promoting facilities. So then what were the characteristics of people in these groups? That would be interesting to us to see. Were there any interesting patterns or types of people that fall into these groups in terms of availability of these programs? Well, we found that for groups 1 to 4, where these programs were generally available to people, there was a lot of variation in characteristics. There's nothing that really stood out to us. I mean, the things you could always speculate that certain factors are associated with physical activity and access to resources, but nothing really stood out to us as being an obvious characteristic that might describe why people have more access to these facilities. What was interesting to us, though, were people who had very low access to physical activity promoting facilities or had nothing at all. And I've highlighted in bold and underlined them in that people who are not white, of not white racial origin, low income, low education, being an immigrant, and having medium to high physically demanding work, working for long hours in the day, in the week, and having poor health and mental health, these were people who had the lowest access to these resources. And if you are aware of the physical activity literature, these characteristics are often we would associate as people who have the lowest access to these resources in general in their lifestyles. Often these people are characterized as being of lower socioeconomic status. So it makes us think maybe it's a double whammy. They have low access to these physical activity promoting resources at work, and it's probably likely that they have low access at home as well and in their environments outside of work. So in summary, there's a lot of different variations of health promoting, physical activity promoting workplace facilities at or near work available to Canadians. But some people seem to have more access than others, and people who seem to have the lowest access to these resources seem to be those we might think might need them the most if these facilities are in fact getting people to be more physically active. So then the next thing is finding this association with leisure time physical activity. So we have all these combinations of workplace facilities, and well, there's a lot of variation in these characteristics. So we wanted to find a way of controlling or isolating just the effects of these facilities themselves on activity. So we looked at what the literature tells us as factors in the individual level and the occupational level that might affect whether someone is having access to a facility or is more able to take part in exercise or not. And we equalize them. So by equalizing them, we kind of clone these characteristics, and the technical term is doppelgangerism. No, they were just made equal for each group, so that that it allowed us to kind of look at these individual facilities and these combinations of facilities and see what is the association with leisure time physical activity. So the characteristics that we isolated or controlled for and equalized across the groups were seasonality. So this idea that our weather affects how likely we are to go outside and be active or take part in outdoor activities. Also individual characteristics, so beyond just age and sex and other things like that. We looked at nutrition. We looked at self-perceived health and mental health. And we also looked at occupational characteristics, so income, hours worked per week, as well as people who may be having physically demanding jobs where taking part in a lot of heavy lifting or pulling might take away from your energy to take part in exercise the rest of your day. So we considered all of those factors in our analysis. So then we looked at the association between each of these facilities to see, are people, in fact, is there an association between having these facilities and being more active, or at least moderately active, compared to being inactive. So looking at all these different combinations, I've kind of highlighted in green as people who have become more active and people who have become moderately active for each of these groups. And what the numbers in each row suggest is the increase from 1. So 2.08 means that there's almost over a 200% increased likelihood that that person in that group, in this case having access to all facilities, is likely to be active. So going through each of these groups, people who have all those facilities available to them are the most likely to be physically active. So the next, you'd say, then the next group, they're also likely to be physically active, maybe at a lesser magnitude, but also likely, same with all the other groups. So nothing out of the ordinary here. And if you look at all the, in terms of having all access to facilities, that also increases your likelihood of being moderately active and also having a pleasant place to walk, showers, and health programs. So fine and dandy. I've practically told you nothing you didn't know already, right? Like these programs work. They get people to be physically active. Why is he here? Why did he make us come here, right? So each of these combinations are associated with increasing leisure time physical activity. And we found that at least among all the combinations, having access to all these facilities seems to be the most associated with increasing leisure time physical activity. Now, I'm sure some of you are thinking, though, how do we know that it is these facilities that are causing this relationship between increased leisure time physical activity? How do we know it's the facilities themselves or other factors that might be playing a part? These other factors could be social desirability. People filled out these surveys trying to do what they think, or filling them out thinking that these are their ideal responses that we want these people at StatsCan to see. It could be that people who are the most active could be seeking out employers that are in line with their own beliefs, who have these resources available to them. Or it could also just be the built environment itself. People who are working in activity-permissive workplaces are going home and have access to these resources at home as well. So we wanted to kind of isolate now to see if, in fact, the facilities are causing or are more associated with these activities, with leisure time physical activity, than maybe other things that could be causing these effects. So what we did was we looked at the association between these facilities with plausible physical activities versus less plausible physical activities, and then went to see if, in fact, they are meeting physical activity guidelines. So by plausible physical activities, I mean things that might be related to, say, going out for walks. So having a nice place to go for a walk or jog could be associated with walking for exercise. So those people are probably more likely to do that, probably more likely to go out for a bike or go out jogging. People who have access to a gym are probably more likely to do weight training or exercise classes. And field sports might relate to availability of an open playing field around work. In terms of non-plausibly associated activities, we don't really expect people to go out skiing in their lunch break. We didn't really expect people to take part in home exercises because we're really thinking about things provided by work. So we wanted to see if, in fact, these associations with these facilities are related to these plausible activities, and are these people meeting physical activity guidelines as a result of these facilities. So what do you guys think? Do you think that there's any of these groups that are probably more likely to work over others? Does anyone think the first group, the all combination, is going to work? Yeah? Who thinks that none of these are probably going to work, if we think of that? Who thinks that maybe it's just the resources we have around us? Good. So I'm around a very, very engaged group, people who have already drunk the Kool-Aid. That's great. Yeah, Mary?
Depends on your workplace.
Right. Yeah, yeah. So I mean, I'll get into what this study can show and what the study can't show, but that's a possibility. So this is kind of now looking at those organizations or those resources that are probably affecting one or the other. There wasn't a major difference between the plausibly associated activities and the non-plausibly associated activities. And those were having a pleasant place to walk and a playing field, or a pleasant place to walk, a gym, pleasant fitness classes, showers and changing rooms, or health programs, or a pleasant place to walk and showers. So those we didn't find a significant difference between the two. So it's probably likely that something else is playing a part. Maybe it's the environment, maybe it's social desirability, maybe it's someone's motivations to take part in exercise. But we did find some possible candidates. The first being having access to all physical activity facilities at work, and also having a pleasant place to walk and showers and changing rooms and health programs. So why might that be the case? Well, we don't really know, but we can at least speculate. So the way our study was designed, we can't really tell why, but we could speculate that maybe having access to all these facilities gives people options. So having different options means that they're more likely to do something that they enjoy doing. And maybe there's something about these particular facilities. So maybe having access to a shower and changing rooms might make someone more comfortable taking part in a health program when they know they can get dressed back in their work attire. But we haven't got to that stage where we can really tell what are the causal determinants. And more optimistically as well, that combinations of physical activity facilities are around in workplaces in Canada. And the majority of workplaces are providing direct and at least indirect facilities that are promoting the physical activity of Canadians. So there are some limitations we also need to consider in that this work looked at a cross-section of Canadians at a single time point. So we weren't able to have the quality of data to really see if these facilities were getting people to change their activity behaviors at different points in time. We also looked at access to these facilities, and access is important, but we didn't really get a chance to have a question that really looked at utilization too. So maybe there's access, but we don't know if in fact people are using different facilities differently. And we need to verify these with more precise objective measures to see what in fact people are doing when they're exercising or moving around over the course of their day. So implications of this work. Well, our findings tell us, like I said before, that a sizable proportion of workplaces have provisions that are available to workers to get them to be physically active. So it's positive. And there are things available that you may not have thought about that might be there to help you be active, such as your built environment, as well as maybe the more obvious things like health programs and resources provided by work. Next thing, though, is probably it's far less optimistic in that we're thinking that maybe there is a gradient in terms of the type of people that have access to these resources. Maybe it's the type of jobs that people have, which means that they have maybe people with more physically demanding work could be working in jobs where they have less resources available to them. And with that, there's a downward spiral in that then they go home and they're drained, and then they have less time to take part in activity. And maybe people who have access or less access to these resources at home are having less access to it at work as well. So it means that maybe we need to be thinking about getting these people to have more resources at work, if it's possible, so that at least we can come up with strategies that can promote activity when otherwise they can't do that. And well, we look at resources, but when we think about that onion, there's many other factors that play a part in how active or our propensity to be active or not. And that can be not only to do with our interactions with people, but also our motivations and finding ways to get people to be more in line with believing that being more physically active is good for them. And taking part in things is helpful, but that could also be helpful to maybe come up with strategies that do that. It could be by providing information to people. It could be by providing people targets and goals, or maybe getting organizations to buy into this through programs, practices, and policies that are conducive to workers. So that's it. Relatively short. I just met 30 minutes, but happy to answer any questions that you might have.